It is now over 1 month since the outbreak of Ebola Sudan strain was announced in Mubende district before spreading to other districts, with Kampala and Wakiso being the latest. Since the announcement of the Ebola outbreak on the 20th of September 2022, a total of 109 cumulative confirmed cases, 30 deaths and 34 recoveries have been recorded. Now, the Ministry of Health has announced that vaccination of people who have come into contact with confirmed Ebola cases will start in 2 weeks' time.
The Ministry of Health will be evaluating the efficacy of 3 candidate Ebola Sudan vaccines on contacts in the coming weeks. The candidate vaccines are Oxford from the United Kingdom, Sabin from the United States of America, and Merck from the United States of America. The main objective is to evaluate their efficacy to protect primary contacts of Ebola patients within 29 days of contact. We plan to vaccinate contacts of 150 confirmed cases. This means about 3,000 initially.
The first category would be the contacts in which we can follow immediately. So the answer for those who have already been contacts, maybe we will not be in time to give them this vaccine where it will be useful. The other categories is looking at the risks. We will see whether we need to also include frontline health workers to be protected as well.
With confirmed cases in Kampala and Wakiso, the Ministry of Health is setting up other treatment facilities.
In Kampala metropolitan area, we have 2 permanent treatment facilities in Mulago National Referral Hospital and Entebbe Municipality. The Mulago Ebola Treatment Facility is a 120-bed facility that is co-located but separate from Mulago National Referral Hospital. This facility is currently housing the 55 quarantine contacts from Kampala and Wakiso. They will be evacuated this week to create room for admission of both suspected and confirmed cases.
There are other trial treatments being used on Ebola patients, and according to Minister of Health, positive results are being yielded.
There is no known treatment for Sudan Ebola virus. Currently, there are a number of promising treatment options that the Ministry of Health is using under trial, including monoclonal antibodies and repurposed drugs like remdesivir, donated by the US government. However, the doses available are still very few. So far, 13 patients have received these trial drugs with relatively good outcomes.
The epicenter of the epidemic remains Mubende and Kasanda districts, and the government has put in place a number of measures to control the spread of the disease, noting
intense risk communication to sensitize the communities about Ebola virus disease, its cause, presentation, and prevention.
Currently, there are 45 active cases of Ebola, and the population is highly encouraged to observe prevention and control measures. Joshua Kagoro, Adia Nakoti, UBC News.